Now, in our first story in this bulletin, there's a crisis situation in the Ashanti region in the treatment of its COVID-19 cases. So far, the region has recorded 2,403 cases with 38 deaths. At a news conference, Ashanti Regional Director of Health, Dr. Tim Crnston, said almost all treatment centers in Ashanti region are full. Meanwhile, a total of 97 healthcare workers have been infected with COVID-19 in their line of duty.
Almost all the treatment centers are now full. Kofanoche has 18 beds. The 18 beds are now full. Kumasi South have 20 beds. So as at now, we have a total of 38 beds. All the 38 beds are now full. So what we've decided to do is that we need to expand the number of the beds that we have for the treatment centers. So we've decided that we are going to expand Kumasi South from existing 20 beds to 41 beds. As at now, we've been given another ward. Work is rapidly ongoing to make sure that we expand it. We've also secured 7 beds at Central Hospital to support our treatment facilities. And we are also negotiating with one of our senior doctors who has decided to give us his hospital to be used as a treatment center. When that one is finally done, we hope that we can add about 100 beds to the treatment centers that we have to make sure that it will be up to about 38 beds. Because the numbers that we have here and the number of cases that we are getting, it said that we cannot contain it. The challenge we have here is the way cases are referred to our major treatment center, Kofanoche. Most of the cases are being kept in various hospitals, and when the situation gets worse, then they say, go to Kofanoche. And by the time you get to Kofanoche, less than 24 hours, then you are gone. I don't think that is good enough. We need to build the capacity of our peripheral facilities also to support the process. We'll have to build the capacity of the nurses there to identify the cases. The challenge we have with COVID deaths that we've analyzed here is that most of the deaths do not come with the classical signs and symptoms that we know. The cough, difficulty in breathing, and other things sometimes are absent. All that we get is malaria-like symptoms. So people assume that it's malaria. By the time we get to know that it's COVID, then a lot of health workers have been exposed. And because of that, most of them are now doing self-isolation. So there's a need also at the national level to review the signs and symptoms and then share it with the private facilities so that we do not focus only on certain signs and symptoms like cough, difficulty in breathing, and then it's COVID. Because in Ashanti region, we are seeing quite different picture. It's fever and general malaise. By the time you have difficulty in breathing, then you're almost gone. So it's another work that I think we will need to do here. The number of isolation centers will also have to be increased because we are having an increasing number of cases.
Also warned the Ashanti region could see a spike in cases and mortality if people continue to flout the directives to wear face masks and observe social distancing.
Going around the region and especially working in Kumasi, sometimes you feel so disheartened because people don't want to adhere to the protocols and then the guidelines. Now we don't see the Veronica buckets anywhere. The social distancing protocol, nobody is observing it. You tell people to wear face masks and they are insulting you. With this, we can't fight COVID-19. People get conditioned, we want to support them, they fight with us. How can we fight COVID-19 in this situation? The box starts with you. The president has instructed that we enforce it. This morning, I went around looking whether people will adhere to what the president said. Some of them, they've disregarded what the president said. They are still walking around without their face mask. They are not observing the social distancing. So what do you want us to do? Ask people. That is not the way to go. Because right now, you know, we've lost a doctor, a hard-working doctor. And if it's to continue this way, what will happen? We are going to lose more. So my only appeal to people in Ashanti region is that let us obey instructions. Let us adhere by the laid down protocols and then the guidelines. Because with the ease of restrictions, it's likely that we may have cases going up. The facilities that we have in Ashanti region, as far as case management is concerned, is nothing to write home about. Accra may have UGMC, they may have Kolebu, they may have 37 military hospital, they may have police hospital. Ashanti, apart from Konfanochi Teaching Hospital, we don't have any facility that we can say can manage severe and critically ill. And that means that if we continue in this direction, we will see high mortalities. So what we need to do as a region is to make sure that we adhere by the public health principles. Other than that, we will have a lot of challenges. So the media, what you can do to help us is that let us try and then talk to people who don't want to obey any law in this country. I believe that it's time that we deal with them. We need to enforce the wearing of the face mask. And I believe we have the support of our regional minister. Even he started. And then some civil rights organizations and other things came in and said it's against the law. Nothing is against the law more than your life. We will not continue to live in this situation in Ashanti. And yesterday, talking to the regional minister, whether you like it or not, we will have to enforce it. And I believe that that is the only way we will have to go.
Definitely some issues there worthy of concern. Now, joining us on the line is Deputy General Secretary of the Ghana Medical Association, Dr. Titus Baio. Dr. Baio, thanks for joining us. What do you make of the announcement that Dr. Emmanuel Tim Crnston just made?
Good afternoon, Daniel, and good afternoon to your viewers. Unfortunately, I didn't hear all part of the speech. I heard a latter bit of it saying that the face mask use is mandatory and is the only way, and the fact that the facilities, they don't have any proper facilities for management. I don't know if there was more to it that I missed.
Well, he began by saying basically that almost all the isolation centers in Kumasi are full, and very soon they will struggle to get space for COVID-19 patients in the Ashanti region. That's the footing on which he started. What's your reaction to that, Dr. Baio?
So, well, that is a statement of fact coming from him, and I would accept that fact. I, however, would disagree with him that the only solution we have is the use of face masks. I think this management of this pandemic is multi-pronged, but gradually, if you listen to the communication from officialdom, it's like managers of our healthcare system, government, are really, for want of a better word, shedding their responsibility and adding it to the individual. There is a role to be played by government and by management. If the treatment centers are full, of what use is face mask alone? The face mask, yes, is useful to us, but we must take concrete measures as to what we are going to do to expand the capacity. And if we cannot expand the capacity, then we should take a national decision to reverse some of the easing of restrictions that we have done, being mindful that we are in a state where now the managers of our healthcare system are saying that the facilities are full. This is perhaps one of the first admissions we are hearing directly from a director or for a manager of the healthcare system admitting that the facilities are full. When the media raise these things, often what we hear are defense coming in from the managers and directors that there is capacity. But if they are admitting that it is full, then it is high time they advise government and take more concrete decisions at our levels of protection. The levels of protection of the community has a governmental level, we have the community level, and we have the individual level. We are now hammering on only the individual level, which is that everybody should wear face masks, use the preventive etiquette, and all of that. Even when we all practice that, some people will still get it, and those people will need to be managed. So what is government doing about that? Secondly, in terms of the restrictions, if we have come to the point that we know that now our facilities are getting choked, we should all come out.
Dr. Baio?
Yes.
Yes. So I just want to get this quick reaction from you on another point that was made. Dr. Tim Crnston again revealed that 97 healthcare personnel in the Ashanti region, particularly doctors and nurses, have contracted COVID-19. One person has died, unfortunately. Being a doctor yourself, what do you make of this?
It is sad. We expected that we will bear the worst brunt of this disease, we doctors and nurses and healthcare workers in general. In fact, from our data, the largest number of doctors affected so far appears to be coming from the Ashanti region. Unfortunately, majority of these are our younger colleagues, the house officers, the junior doctors, first year house officers, second year house officers, the medical officers. And we need to look at what protection are we giving to this group. So it is an unfortunate event. We expected it, but I don't know. It means that we have to up our game in terms of the protection of our health workforce.
You mentioned that most of the people who are dying are the younger medical population, and these are the ones who come in direct contact with the patients. Does that mean that they are not getting enough PPEs, Dr. Baio?
Well, the information we are picking from our members is that the PPEs aren't enough. We've had issues about even the type of PPEs that are made available. And also, if you look at the statistics we have, that definition of frontline needs to be looked at, because most of the attention and distribution of PPE and everything has gone to treatment centers and isolation centers. Majority of these doctors and nurses who are affected are ordinary doctors working in ordinary healthcare facilities that will manage a case, and before they realize the case is positive, and their level of protection is very poor. So we have issues with PPEs. We have issues with delays in testing, and that is another major block that is leading to the infection of several healthcare workers. Because if one person is suspected and we take the sample and it takes a long time, sometimes by the time the report comes, the person is dead. You can imagine the number of people who get infected.
Wow. Dr. Titus Baio, thank you so much for joining us this afternoon. He's Deputy General Secretary of the Ghana Medical Association. Now, the Electoral Commission says it has already begun implementing the directive of an Accra High Court. Now, we'll get more on that story in just a few minutes. But before that, Ohiming Teria, he witnessed that news conference live. Ohiming, very worrying statistics that Dr. Tim Crnston put out there. Give us a bit more detail of what the director said.
Yes, Daniel, what is more worrying is the fact that many people in Ashanti region are not adhering to protocols as announced by Ghana Health Service, especially on the wearing of face masks, adhering to social distancing, and also people paying so much attention to their health. So Dr. Tim Crnston says it's a worry. And if you compare to the other information that he gave, now with a 207 isolation center, bed isolation center in the Ashanti region, 156 people are on admission. And if you look at the treatment center, the one at the Kumasi South Hospital, Konfanoche Teaching Hospital, they are all full. It's being occupied by COVID-19 patients. So he says, whilst efforts have been made to expand the treatment center, there's also the need for people in Ashanti region to adhere to social distancing and also practice hand washing. He mentioned in particular, gone are the days where you see people in Ashanti region washing their hands from Veronica buckets, but the Veronica buckets are mixing in Ashanti region. And he says if people continue to disregard or blatantly disregard social distancing protocol, wearing of face mask, and also hand washing protocols, then it will go a long way to increase the number of cases that we have in the Ashanti region and also increase the number of COVID-19 related fatalities in the region. Currently, 2,403 people have tested positive for COVID-19, and the region has also recorded 38 deaths. And the concern is that most of the people who have died are not showing signs and symptoms of COVID-19. Daniel.
Right. Ohiming, did Dr. Tim Crnston specify what efforts are being made to expand the capacity of these isolation and treatment centers?
Yes, he did mention that with regard to isolation center, the Regional Health Directorate have secured the Ghana National Association of Nurses, their hostel in Ejeso, to be used as an isolation center. Now, he also mentioned the fact that the Kumasi South Hospital Treatment Center is being expanded from 20-bed capacity to 40. And then the Konfanoche Teaching Hospitals one is also being expanded. And a doctor in Kumasi has also promised to release a facility to be used as a treatment center. So the Health Directorate in all is looking at expanding the treatment center from the current 48 to 138 in Ashanti region, Daniel.
So, Ohiming, we know that because of the challenge with getting patients into isolation centers, some COVID-19 positive patients were kept in wards with patients who don't have COVID-19. Did that come up in the Ashanti region?
That actually did not come up in the meeting that we had with the Ashanti Regional Health Directorate and his other supporters here. But what we do know is that because the treatment centers are full, for instance, a patient over the weekend was turned away from the Kumasi South Hospital after he was referred from the Suntreso Government Hospital. Though the Health Directorate raises concern about the manner in which the patient was transferred from Suntreso to the Kumasi South Hospital. But the underlying fact is that the treatment center was full, and that it raises concern and issues about how COVID-19 is being managed in the Ashanti region. So Dr. Tim Crnston says that if residents will complement the efforts of Health Directorate by adhering to all the protocols, and also our efforts are being made to expand the treatment center, then the fight on COVID-19 can be won. But the Health Directorate is already overwhelmed because they never anticipate that the figures will rise from 1 to 2,403 cases in Ashanti region. That is something that Dr. Tim Crnston admitted.
Thank you very much, Ohiming Teria, for joining us this afternoon on Joy News today. Back to politics, and come Saturday, June 20, delegates on the New Patriotic Party in 165 constituencies will head to the polls to elect parliamentary candidates for the 2020 elections. Your election headquarters, as always, will come with a comprehensive coverage of that election. Now, joining me in studio to share with you plans for our coverage this Saturday is my colleague, Winston Armah. Winston, there's no doubt we are the reference point when it comes to election reportage in the country. Give us a bit of what to expect on Saturday.
Of course, Daniel, you've actually said it right. We are the reference points, your election headquarters. So we're starting at exactly 7 when the elections begin, up until the time the final, declaration. And of course, you can also trust us with, in-depth analysis, critical analysis of all the constituencies. I know there's been a lot of talk about, the battleground, but imagine going to the Nkoko constituency, where you have the current member of parliament and Eastern Regional Minister facing a competition from 5 persons, including 2 former members of parliament, and currently the CEO of the Ghana Publishing.
David Asante.
That should be interesting.
That's one of the battleground seats, isn't it? There's also Dome Kwabenya
and a lot with
there's
Dome Kwabenya, there's Mpraiso, where Davis Opoku Ansa of AFAG is challenging the current, chairman of the Defense and Interior Committee in Parliament, Seth Kwame Champon. How about, Adansi Asuka, for instance, KT Hammond? He's been complaining.
With Samuel Binfo.
Thank you very much. So, you can expect us to give you up-to-speed coverage with great analysis of everything that you need to know about the NPP parliamentary primaries. We're going to ensure that when you watch us on, Joy News channel, listen to us on Joy FM, you wouldn't miss anything. Talk about the historical antecedents. We have them for you. If you go to the Dom Kwabenya constituency, you're aware that when the constituency was carved out in 2004, Michael Okoye served 2 terms. Adjust Afo in 2011 squared it out with Michael Okoye Jr. Michael Okoye Jr. didn't make a comeback in 2015, but he's coming back in 2020. How does that pan out? Wow.
I can't wait. Saturday morning, 7 a.m., Joy FM, Joy News. We will be getting the latest. Thank you so much, Winston, for giving us that idea. It's so live on Joy News today with me, Daniel Dazi. We take a few messages. Coming up in business, $20 million soybean cultivation project commissioned in the northern region. Stay with us.
To business, my name is Darryl Kwao. A $20 million soybean cultivation project has been commissioned at the Sakwe community in the Mion district of the northern region. The 40,000-acre farm is said to be one of the biggest in the region. Correspondent Martina Bugri has more.
The project is to increase domestic food production to address the major vulnerabilities in Ghana's food supply chain that has been further disrupted by the COVID-19 pandemic, and also to offer employment to about 400 people in the area. At the launch, some farmers who spoke to Joy News said the project will address the loophole in the price and value chain of soya bean. Madam Abiba said it will also help them farm soya bean in large quantities.
It will help us increase our farming, and we will sell it directly to you and make more profit. We will not sell it to the market women again.
The project coordinator in the community, Ganiu Osman, believes the project will succeed and farmers will benefit immensely.
And the reason why we give this largest farm to the gold company, we are here, we cannot get support to do largest like how the gold company did. And this one, we are committed people, we are praying to Almighty Allah to support them so that the community can benefit through this farm. Because we can get work, we are not getting work to do. We are farmers people, and we don't get money to make largest farm like this. So we are happy for this company is here. We are happy for them to do this big farm for this community so that we'll benefit, we'll get work. So
the Chief Executive Officer of GGF, George Boachi Sapon, said they decided to invest in the project, especially in the northern region, because of the suitable climatic condition of the area and the vast arable land.
We decided to come to northern region because, one, there is vast availability of land. My background is telecom. I have spent over 10 years in telecom. I've traveled every part of this country, and I have identified that there are huge lands here that are arable and suitable. Again, the climatic and the soil condition is very good for the crops that we are doing, mainly maize and soybean. And because of the high, humidity down south, when you cultivate these crops, you easily get contamination with aflatoxin and other pests. But over here, because of the dryness, it is easy to dry the grains when you harvest, and you are already, cutting costs by, cutting the level of manual drying that you have to do. Again, the people here, if you look at the north, there isn't much development. We have the vast land, but the people are so nice. They are very, very welcoming. We came to see the chief, and straight away they said, all these lands are yours. We use our GPS to pick up points, and we are already identified over 40,000 acres. So we have signed lease on it, and we are ready to work.